injections, butt injections, right? The fake stuff, the artificial materials people get injected. Um, the issue is that it's potentially dangerous. And in England, in the UK, they've got a couple stories here with a clinic that really went sideways. And it's not just the clinic that went sideways. It's also the clinic is teaching people how to do this. So let me make sure I got my details right. So if you guys haven't seen this story, there are a couple of stories out of this same clinic, but let's see. This is a non-surgical BBL. Right? This is having artificial injections into the butt, and we don't have this stuff in the United States, even though people do. And this stuff is actually illegal. These injections are legal in Europe and in England, where this happened. It's usually a hyaluronic acid material, and so the hyaluronic acid material gets injected, and it's instead of using fat, and it works okay. Injecting hyaluronic acid anywhere does about the same thing, but the stuff that they're using, first of all, is a little thicker than the stuff that we normally use, and it's made to be a little thicker and take up more space, draw more water, and add more volume. And it lasts a long time. It lasts a couple of years, from my understanding. We don't have it here. It hasn't been approved in the United States, so you're not seeing this here. The stuff we see here with butt injections is a whole other ball of wax, and it's a disaster. The things that we see, I just saw a patient yesterday with artificial injections that's going through a rough patch. That there's no way to go back. You can't put the toothpaste back in the tube. Once those injections are in, you got to live with them. And in the case of the artificial stuff, that the illegal stuff here in the United States, that's a real disaster. But what happened in this story is not much better. This is a story of someone that had a non-surgical BBL, a liquid BBL, and it says it involved hundreds of cc's of cosmetic filler being injected into the butt. Now, let's see the details of this case. There is a patient by the name of Kelly Crease that found this place called Lift Aesthetics on Instagram, of all places, of course. And so on Instagram, she found this clinic called Lift Aesthetics in the UK, and she booked a liquid BBL, and she went to have it done. And then 2 days later, she started not feeling very well. It says, I felt like I pulled a muscle under my arm. Kind of an odd place to have a problem if you had your butt injected. And it said, I thought it's really uncomfortable, and in an hour, I couldn't walk. But things are going south fast, right? And so she was laying down, took some painkillers, and then started thinking, gee, maybe this shouldn't be this way. Then she started getting fever. She said she was getting disoriented, started losing her vision. Well, that's a pretty bad sign. So he said by about 9 p.m. that night, they had to phone an ambulance. And then she was taken to the hospital, and they said that if she had stayed at home, that she probably would not have survived. So she was given IV antibiotics in the hospital, and took antibiotics for about 2 weeks, and she was allowed to go home, but still has a lot of trouble. That patient was the second patient. She actually called the website, the ITV.com. She called ITV News, actually, after seeing Louise's story. Well, Louise's story, let me see if I can get that story. This is really pretty crazy. Louise Muller, 27-year-old hairdresser. She went to get the liquid BBL. Now, 2 months after having her non-surgical BBL, she still has a healing wound, and this is how it happened. She'd had fillers. She figured, oh, well, it's just a filler. How bad could it be? Because, you get fillers in her lips, in her face, and so this sounds good. And it's probably a lot cheaper than having a surgical BBL. So she saw an ad. I'll tell you, it's a lot cheaper. £1,500, which is roughly $1,500. And went for $1,500 to go get these filler injections into her butt instead of having a surgical BBL. Way cheaper. I mean, it's 1/10 the price probably, and went and had it done. Then she got there, and the procedure was not carried out by the clinic, the Lift Aesthetics Clinic. It was carried out by a company called Non-Surgical Clinic in Essex, Non-Surgical Clinic Essex. So she went ahead and had it done anyway, and wasn't really happy about the hygiene, the cleanliness of what was going on. Said she took photos, and showed some kind of messy things around the clinic. And she said, I was told that the procedure was not painful, and it felt like a stabbing pain. Then I got a shooting pain. I screamed and said that really hurt, and then when I left, the pain wasn't going away. The pain really isn't the issue. She started getting a really bad infection. She contacted the clinic and she was sent antibiotics to be taken, but her temperature kept going up. And then she started getting nauseous and vomiting. So this is, again, it's going sideways really fast. And so she ended up going to the hospital and said that the doctor that started in the hospital said that he needed to operate on her in the next 20 minutes. Otherwise, she might not survive. A little bit of hyperbole probably, but maybe not. It nonetheless is a very severe infection. They said she showed up in sepsis with an infection in her butt. She had surgery, opened it up, drained the area, and then she had a dressing. Looks like she had a vac placed in that area. And they have a picture of what her butt was like, and it's a huge area, like this big, showing big red angry tissue. And you guys can check this out on itv.com. It's really kind of crazy. The course in the hospital, while in the hospital, she had an operation to drain the abscess, remove tissue from her butt, and that treatment, she's still having debridements even 2 months after that initial operation. So it's not a good thing. It's a real problem. The procedure should have been pretty straightforward, injecting artificial material, but it's still, having these things done, getting the non-surgical stuff doesn't mean no risk, right? And you still have to respect it as a medical procedure. So it's not done under clean conditions. I mean, it should be done under sterile conditions. But if it's not done under sterile conditions, well, you run a higher risk of infection. These are still sterile fillers that have to be injected. It's got to go through skin. You've got to keep things clean, and you're injecting multiple times throughout multiple areas. So you have to really respect the sterility of the procedure. A lot of these things get done in not the most sterile environments. A lot of times it's in people's homes and hotel rooms. I mean, in this country, in Miami particularly, we hear about this all the time. They used to have butt shot parties. And the people doing them are typically not medical people. So this is a real issue. I'm not sure what to say about it because, you would think people would have the presence of mind, if you're having to go to a hotel room, the person's not a doctor, well, going to a hotel room right there, I mean, that should raise some big ass red flags, right? You should not be getting your health care in a hotel room. And if you're going to a hotel room, it really ought to give you some second thoughts. Now, when the person giving you your treatment is not a doctor, that's number 2 on the list of maybe I shouldn't be doing this. And you really have, people get lured in by these prices. Instead of paying $10,000 to $15,000 to have surgery, they're paying $1,500 to have injections, which is very attractive as an option, right? Way less expensive, and you figure, well, I'm going to get a similar result, until you don't, until it really gets out of control and you find yourself in the hospital with an infection. Now, you can get an infection just from having any treatment, right? It's not, I mean, you can get an infection from surgery too, and you get some, that happens every now and then. But putting yourself in the best situation to get the best result is really what you ought to be doing. So, going to a hotel room, non-doctor, not what you ought to be doing. If you put yourself in the situation where you've got the best opportunity to get a good result, well, that is at least putting the odds in your favor. Doesn't mean you're not going to have an issue. I mean, you still could have an issue. But chances are that you're going to fare a lot better in these circumstances when you're being treated by a doctor in a proper clinic or an office or a hospital, and you're being cared for by someone who has experience. And if things go bad, that person can take care of you. What do you do when you've been to some, hidden office in a house or in a hotel room, gotten a treatment that maybe isn't totally legal? This all, as I'm saying it all seems like it should be common sense. Sometimes common sense is just not common. Keep yourself safe. See doctors. See board-certified doctors, board-certified dermatologists, board-certified plastic surgeon, board-certified facial plastic surgeon. See someone who knows what he or she is doing, who has the experience, has the training, and that if something goes wrong, they can take care of you. You want to make sure you're being cared for. So, it's serious business getting this stuff, even if it's just injections, right? And I love, where this comes up? It comes up with lipo a lot. Because people think lipo is not really surgery. Oh, it's just lipo. It's just lipo. There's a lot of complications you can get with lipo. I do a pretty good amount of expert witness work when things go south and people are looking to maybe sue somebody, and they go to a lawyer, and sometimes a lawyer will contact me and say, hey, take a look at this case. We see a lot of cases arising out of liposuction, terrible injuries. So this whole sense of, well, it's just injections, it's just lipo, that's not a great point of view. Make sure that you're in the right place with the right kind of doctor and respect the process. Even if it is a smaller process, even if it's just injectables, just lipo, it's all medical treatment. So make sure you're getting medical treatment from a medical doctor, not from someone who took a weekend course. Or, down here we see a lot of South and Central American people that claim, oh, I'm a doctor in my country, or I'm a nurse in my country, or I trained with, I trained from the most famous doctor in my country. There's a reason that there are licenses in this country, in our states, to be able to practice. There's a reason that there's board certification, and that there's training procedures, and there's standards of care. Don't settle for less than someone who's properly licensed, properly trained, board certified. I say this as a mantra. If you guys have been following me, I talk about this all the time. Make sure you're in the right situation. You'd think it's really straightforward, but it's not that straightforward. And not for these people who kind of got lured in and then it's too late. So, what do you got, Melina?
So we have one brave Amaris asking a question for you.
Okay.
So she's wondering, I have how is the incision if you already have breast implants behind muscle if you want to get a new pair? Is it huge scar or is it done hidden by nipple?
Okay. And this is Beatrice?
It's Amaris.
Amaris, thank you for sending the questions. The question is, sounds like she has breast implants, so she's asking about someone who has breast implants and wants to exchange the implants, and she wants to put in new ones. So she's asking, what about the incision? In my practice, and I think it's what most doctors would do, if you've already had surgery and you've got a scar, it's really not much of a reason to create a new scar. In most cases, the scars are either at the edge of the areola or underneath the breast. If you already have one of those two scars, in my practice, if you come to me to have that implant exchanged, we're going to use your old scar. As a matter of fact, I'm going to remove your old scar, and we're going to just leave you with one when we're done. I actually cut out the old scar, go through that same area, get into the pocket where the implant is. I do a lot of corrective surgery. So if you guys follow me at Dr. Rubenstein on Instagram, you'll see that I do lots of corrective surgery, and we share it. So if you're not following me, check it out. Follow me. We show clips in surgery all day. We did an upper lid operation today. We shared the whole procedure so you can see step by step how I do it. And we do tons of breast surgery and a lot of corrective surgery. When I'm doing the corrective surgery, if the patient has, or just an exchange, maybe you just want to be bigger, smaller, maybe maybe it's not an issue with having a problem, but whatever the second or more operation is, when you've had previous surgery and there's a scar there already, there's no reason to give you new scars. So I make an incision and remove the old scar. We go through that same area and then do whatever we have to do on the inside. And I could talk a lot about how to do the exchanges, how to do the revision surgery. We do a ton of it. Those of you who saw me on My Killer Body, that was hosted by Kay Michelle, it's a Lifetime TV show called My Killer Body. You can check it out on lifetime.com. The whole show is about people, men and women both, that had a rough go getting cosmetic surgery procedures and had to come back and get corrective procedures done. And the show was all about getting those things done and helping them turn the page and go on with their life and having all that corrected. Kay Michelle, you probably know, was very famously had her issues too, and she got better, and I'm sure she's still dealing with some portions of things. So when it comes to breast surgery, if you've had surgery before, we try not to make new incisions. There is an exception though. If you had surgery in the underarm, or if you had surgery through the belly button, especially the belly button, you cannot do corrective surgery through those approaches. The belly button is just ridiculous. I don't even like the operation. I don't do the operation. I think it's a silly way to put a breast implant in. And by the way, you avoid the warranty on the implant when you put it in that way. So that shouldn't even be done. But if you've had that done, you just can't do revisions through that incision, that approach. In the underarm, there are some rare instances you can do implant exchanges. There's some things that you can do, but you can't really have the same control. So if you've had your breast augmentation through the underarm and you come to me for a revision, probably we're going to need better control of the pocket, which is going to happen. My preference is at the edge of the areola, but you can do it from underneath the breast also in the fold. But if you had either one of those, I'm not going to give you a new incision. We're just going to remove your old scar and work through that same spot. So thank you, Amaris, for that question. And you guys, if you have questions, chime in, DM them, put them in the chat on the live, and I'm happy to answer.
Alina has a question. Alina Popa is asking, she's saying, good evening. Have you treated patients with problems after injection with Aquafil in the gluteal region? If so, what protocol did you follow?
Okay, well, it doesn't really much matter. So this is from
Alina Popa.
Alina from? Do we know? No,
we don't.
Okay.
Alina Popa.
Alina
Boba.
Alina Boba. Oh, well, Alina. I'm just going to say Alina because, we all know Boba. I guess that's your name. Great, but I want to make sure it's not like a cutesy thing. Anyway, Alina, thank you for sending the question. And I hope that you're not asking about yourself because these things are big problems. And I think you might be asking about Aquamid, but it doesn't matter which material so much. Different materials will have slightly different reactions, but when you have butt injections with artificial stuff, silicone, biopolymer, Aquamid, and there's various brands also of all these things. Biopolymer is kind of like a catchphrase people use. If you hear people talking about, I had biopolymer injected, there's no material that's called biopolymer. There's various types of these things, and they're pretty varied. They're made by lots of different companies, but they all react in a similar way, and it's not good. When you have artificial injections in the butt, initially it may look great, it may feel good, and if you're lucky, you may never have a problem. But if you're not so lucky, like a lot of people are or are not, if you're not lucky, then you may find yourself with a lot of different changes. Here are the things that happen when you have artificial shots in the butt. Usually the first thing that happens, you start feeling a little bit of pain because it causes inflammation in the area. So as that inflammatory response brews up, you start feeling some tenderness. And then that inflammation can make the tissue start getting a little hard, and it firms up, and you can feel it just like touching it. It feels hard. When you touch your butt, it should be fairly soft and a little bit mushy, kind of like a sponge. It goes in and out, and it's very soft. When you start getting the changes from these artificial shots, that softness firms up. So now instead of it being spongy, it feels a little bit more leathery. It gets firmer, and it doesn't move as easily. It's not as free moving. Now, we're not even talking about infections. Infections would happen usually sooner, and they get red, and they can get hard too. This is different. Over a long period of time, pain, a little bit of firmness or a lot of firmness, because that hardness progresses. So the longer it goes, it gets hard like a wood table. It can get really hard. You touch one spot and the whole thing moves. When you push something, it should comply. But when the area gets really hard, and these are some of the skin changes we see with artificial injections, you push in the middle, the whole thing moves as one piece. It should just kind of, it should move just where you're pushing it, but when you push these areas that get really firm, the whole thing moves, like a whole chunk of the butt is moving back and forth as you're pushing just one little spot. And that kind of firmness, that can lead to a lot of pain, because not only is there the pain of the inflammation, but when you sit on that and the whole thing shifts up and it's rigid, it causes a lot of pressure in different areas. So pain from the inflammation, getting some hardness in the tissue, and then as the tissue changes, especially if you have a little bit of pigment in your skin, if you're a little darker color and not, really Caucasian, if you're African American, if you're Hispanic, if you're Asian, it could be anything that has a little bit more melanin in the skin. Having more melanin in your natural skin tone, that sets you up to make more color. So when you have inflammation, it can really kick up the production of melanin, and then the color of the skin can get darker. And that's typically what we see in patients that have darker skin color. That whole area gets darker than their natural tone. So if you're a little bit lighter brown or darker brown, it just gets darker, darker, darker. It can get damn near black, like really, really dark and hard as it progresses. And the worse it gets, the less you can do about it. Once that color changes, it's very, very difficult to get that to lighten up. So the question was, what do you do about it?
Alina's adding to the question, saying the patient has made the injection and the problem is that she still has a fistula and I can't manage to fix the problem.
Okay. So Alina, are you a doctor? Are you a nurse, a doctor, someone taking care of this patient? Let me know what her answer is. Yeah, so we'll get to that, because that sounds like the patient had a little bit of an infection that had to be treated, and it formed this tract and just keeps draining. And I've dealt with that too. It's not easy to fix. So let's go back to the dark, hard tissue. Pushing on it, it's firm. You can't do anything about that except remove it. And so that's a big operation. And I saw a patient yesterday, as I was mentioning, who has a lot of these changes: darker skin, hard, firm patches of skin. But that particular patient was not in pain all the time. It would just come and go. But my advice to most patients that come see me for this, if you're not having constant pain, if you don't wake up every day saying, God, I can't live with this anymore, then you should try and live with it as long as you can, because the process of removing this stuff is just an awful process to go through, and it may be the only thing you can do. And when you get to the point where every day you're in pain and you can't go through your normal day without suffering, then you really have not much else of an option. So then you have to go to the operating room. All that hard, that wooden tissue, we mark that out, we remove that, and that hardness is not just in the skin, it goes down to a certain depth, sometimes all the way to the muscle. But you've got to carve out that tissue, that's got to come out. And it allows for the softer tissue around it to be more normal. The problem is it sometimes takes over such a large area, like the patient I saw yesterday that I keep talking about. Your butt each cheek has a certain size, but in her case, and it's frequently the case, more than 2/3 of the skin had changes. You can't take out 2/3 of a butt and get it closed. So what happens with these patients is you have to take out this chunk of tissue and use dressings. We use these special dressings called VAC dressings, or vacuum assisted closure dressings. You stick a big sponge in there, you seal it with some sticky cellophane tape kind of stuff, cut a little hole and stick a vacuum hose on top of it. And that vacuum takes the sponge and then shrinks it down. It pulls all the air out of the sponge, and that draws the tissue in. And it will only draw in as far as it can. You know, at some point you reach the limit, and it's just constantly sucking the bad stuff out of the wound. And that negative pressure pulls the edges, and that pulling the edges that way induces the tissue to grow. Over time, that big hole becomes a smaller hole and a smaller hole, and eventually you can go back to the operating room, just kind of loosen things up and bring it together. It's a long process, and it can take months, sometimes a year or more, to get it totally healed and done.
I think you were answering what Sandy asked right now. She asked if you do reconstruction and BBL on women who had biopolymers removal.
Oh yeah, unfortunately, you know, I think we did one for My Killer Body, the Lifetime TV show. But yeah, unfortunately we do see it down here in Miami a lot, because these butt shot parties were all the rage years ago, and now it doesn't happen right away. That's the thing. It happens a year, 2 years, even more, 10 years down the line. And this patient we saw yesterday was many years ago. She had these injections. I think it was 10 or 15 years. But over time, that inflammatory process just cooks and cooks and cooks, and eventually it bubbles over. And in most cases, you're headed to some kind of uncomfortable change. So yes, I do the corrective surgery, but what I'm describing to you, these are the things you got to do. Sometimes it's such a big area that even with a VAC dressing, you can't just take it all out in one shot. So you do it in stages. Now imagine, every time we do one of these things in stages, we're going, you know, little by little, bit by bit, piece by piece, taking a chunk and then a chunk. Each one of those processes, well, that takes time. Each one of them is, you know, that could be a month process, 2 months process, 3 months process. Every time you're doing it, you have to get that healed to the point where you can get it closed, and now you've got a little bit more mobility with the tissue, and then you got to go to the second stage. So, you know, it's just imagine how painful this is. With big open wounds that are healing, every time you change the dressing, you turn the vacuum off, it expands a little bit, but that sponge has gotten stuck to all tissue on the inside. So now you got to peel off that sticky tape and pull the sponge out of the wound. It's pulling the tissue, you know, it's stuck to it, so you're peeling it away from the tissue. That hurts like hell. And it's just such a miserable process. Yes, I do these operations. I don't like to do these operations because it's emotionally draining for me to see my patient in that kind of pain. But we do those kind of operations when we have to, and it's a huge process. You gotta make sure, we get a lot of patients that fly in from all over the world, and this is not something that you can do flying in and flying out. You have to find someone close to home that can take care of you. I mean, if you're lucky and it's a smaller area and we can do one operation and take out a chunk of tissue and get things closed, then maybe you can do that kind of thing in one stage. I think we had one patient for the show that was like that had a smaller issue with skin changes in the butt. We scar tissue, we were able to do a revision and get it out and improve that situation. But unfortunately, that's more the exception than the rule when it comes to doing these kind of these surgeries, because you're just constantly going back and going to it. So now, was it Alina that had the question about the fistula?
Yes, and she's a doctor.
And she's a doctor. Okay, Dr. Alina. It's a tough problem. So her question is this: when you have these problems, you have these wounds, especially it sounds like her patient had an infection and it wasn't so much all these skin changes.
She added, I tried with antibiotics, vacuum, even surgery, but the wound's still not closing.
Okay, so there's a couple things to think about. Did this patient have artificial injections, or was this a BBL patient that got infected? We'll find out from her. because the path you're going to go is a little different.
She had Aquafil.
Oh, the Aquafil, yeah, Aquamid probably is what, yeah. All right, so artificial stuff. Anytime that you're around the fat and you get an infection, it's not usually just one bacteria. It's usually a whole slew of bacteria. You get like a bacterial soup that sits in there, and you get this abscess. And then you got to drain the abscess. You drain the abscess and you try and do dressings and everything heals. When you drain an abscess and open it up, there's usually a ball of space, right? Because that fluid has been filling that space. And so when you make an incision, you drain the fluid. Now there's a void where that fluid used to be. All that pus and junk that drains out, there's empty space where that used to be. You wash the hell out of that, and then you got to let it heal. And that usually heals slowly over time. Sometimes, when it's taking such a long period of time, that opening kind of matures, and it forms a little bit of a lining or a tract, and that tract just keeps draining. And you try and clean it up, and you put dressings, and it just never closes. That can be because there's still bacteria there, so you can do cultures and see what kind of bacteria might still be living there. But that's not usually the problem. The problem is usually that it has grown a little bit of a lining, or there's still some foreign material in there that needs to be removed. Either way, the treatment is the same. What you need to do is remove that whole tract from however far down it goes and take all that out so that you're left with just fresh, non-contaminated tissue. Sometimes these things can go all the way down to bone. It can go to the joint. It depends if the patient has anything artificial in it. There's stitches in there. Maybe this is a combination of someone that had surgery before. Anything artificial, whether it's a stitch, whether it's mesh, whether it's still some of the product, the Aquamid, or that might still be in there. You got to get it all out. And so here's a great way to do it. You take some dye. We use this stuff called methylene blue. And there's other dyes. Basically, it's like ink. It's like sterile surgical ink. And you inject it into the spot that keeps draining and won't close. And that's going to find its way through the whole tract and then stain the whole area. Then you go to the operating room and you make an incision and dissect all around anywhere you see that ink. You remove all the stuff that's stained with the ink, and you see what's left. And you can follow. That will help you know if you're getting to the base of it, because you can't see the pus or the stuff that's draining out. After a certain period of time, it just starts coming out clear, and you can't really tell. So using the ink, it'll show you all the little channels, all the places where there's still some contamination. You got to get all that out. You might find it's much bigger than you think. You might need to just put dressings and let it heal again. You could use a vac dressing with that sponge and the negative pressure. But you got to get it all out. When you get it all out, it will heal. I've had to do this sometimes 2 or 3 times. You think you have it all out, patient does great, the surface heals. A couple of months later, they come back, doc, it's draining again. Very frustrating. Sometimes, what the problem is the type of bacteria. And there's a special kind of bacteria called atypical bacteria. One of the more common ones is mycobacteria as a type of bacteria. These atypical bacteria, mycobacteria frequently, you have to culture for them very specifically. It's best if you send tissue. So if you have someone who's draining this way and they have a wound that's just not getting better, you might, and if they've had artificial injections or BBL, we see this with BBLs a lot if the sterility was not good, or sometimes it just happens. Take tissue. Don't just swab it up, because normally when we take a culture, we just take a little Q-tip, rub it in there, send it to the lab, they rub the Q-tip on this special culture medium, and they watch it. Problem is, these bacteria grow really slowly, and they're really good at living in low oxygen levels. And they're so slow, they don't require a lot of oxygen, they don't require a lot of energy, and they just grow. It's hard to get rid of, really hard. But you have to know that they're there, and when you get a culture and you can identify the particular bacteria, then you can choose the right antibiotics also, because it usually takes 2, sometimes 3 antibiotics to get rid of these kind of bugs. These are nasty infections, and you can see them with BBLs and with non-surgical BBLs that we were just talking about. So make sure you send tissue for culture if you take that patient to the operating room. If you see something that looks a little bit soupy or dirty, take a chunk of that tissue, send it to pathology, and tell them you want a culture for atypical bacteria, because the culture they do is also special. They use a special medium, and it can take 2, 4, 6 weeks before you see that bacteria growing because they grow so slowly. But once you get it, now you have a diagnosis. Now you know what you're treating. Sometimes just cutting all the crap out makes it better, but sometimes not. So it's always good to send that culture for that tissue for culture. Make sure you see what that bug might be, and if you get an identification of a particular bacteria, and it is these atypical bacteria, the mycobacteria, you'll be so much better off if you know what it is and then what works for it. So if I had that patient, they just won't close, try the ink, settle them in the operating room, dissect down around the whole area, open up a decent incision and just dissect out all the stained tissue, wash it the hell out of it, and then if it can close, you can close it, as long as it's not grossly contaminated. But wait for those culture results, because if you don't get everything out, you're going to see it again.
Sandy is asking, my question is, if the open technique was done and there is a probably 5%, do you do reconstruction and BBL because the area is not flat?
Yeah, well, this comes up a lot too. So when you do these things, people, they think, oh, I'll just get the stuff taken out and I'll be okay. But remember, we're taking out chunks of tissue. And sometimes we're taking out more tissue in the deep part than the skin, because if the skin is good, we can leave the skin. So if you're lucky, it's kind of like a wedge and it comes together and there's no distortion. Most people aren't that lucky. If it's a big chunk of skin but less of the deeper tissue, well, you'll be able to get that closed one way or another. In the worst case, if you do a skin graft and get it closed, it's not going to look great, but it'll be closed and healed. The bigger problem is when it looks like a shark bite. There's skin, but everything underneath is dead or destroyed. And so you have to go in and scoop out all that nasty tissue, nothing that's going to survive, wash it out, and you got to let it heal. Well, you can't fill that emptiness with just anything. So there are options. You can take tissue from other parts of the body. Sometimes you can take it locally and just move things around and fill this big hole that's been left behind. Sometimes you can't. And especially when it's still grossly contaminated, say it was a really bad infection, a big abscess, what have you, you can't just fill that in, so you have to let that sit for a while. Again, very painful. And when you do get things closed, even in some of the smaller cases where it's not giant chunks, there can be divots or indentations in the butt. That's hard to fix. A lot of times these patients don't have a lot of fat to use, and even if you do have the fat, you've got to wait a long time to know that you don't have one of those funky bacteria that are going to grow really slowly and mess everything up, and maybe show up a year down the line and you have the same problem to deal with again. So you got to wait, and you got to live with this kind of deformity for a while. And then when you're ready to fix it, you may have limited choices. There may not be a lot of local tissue. You might not have a lot of fat, but even if you have plenty of fat, that tissue is going to be firm. Now there's scar tissue everywhere. So you have to have it be soft. There's so many factors that go into it, but yes, it can be reconstructed, but that also is a very difficult proposition. You got to see what tissue you've got to play with, how you can move it around, and what it's going to take to get this to look semi-normal. And don't forget, you're going to have scars. Once you've got a scar, you have a scar forever. This kind of, people think, oh, plastic surgeons I'll go to a plastic surgeon and get rid of the scar, or I'll have a laser treatment, get rid of the scar. That's not how this works. When you have a scar, you got a scar forever. You want that scar to be the best quality. Going to a plastic surgeon is a good idea, but we can't get rid of scars. Once there's one there, it's there forever. You can blend them. Laser treatment can sometimes help, but it's not going to get rid of the scar. And the worse, the bigger, the badder the injury is, the longer, the larger the scar can be. So it's not that simple. The best thing to do, just don't do artificial injections into your body, really anywhere that isn't, in this country, FDA approved. For those of you watching in Europe, follow your local guidelines. Anything that you put in your body that's artificial, make sure you check it out. Things like hyaluronic acid, Restylane, Juvederm, these things, they've been around so long, and there still can be some reactions to that, but the problems you have with those materials, they're sterile, they're properly manufactured, the safety of them has been established for many years. You're gonna be okay. Other stuff, like new stuff that comes out, don't be the first kid on the block to try this new stuff. Wait and see how things go. And know that there's risk. What else we got, Melina?
Nothing yet.
All right, well, this has been our first multicast. I think we've been on the air now. We've been broadcasting this podcast for about 45 minutes or so.
Yes, 44 minutes. Amaris is saying, thank you for educating us. You're amazing. I'm so glad I never did anything to my rear. And Dr. Alexia Hoffman is saying, this is such a beautiful live. Pleasure watching.
Dr.
Greets from Berlin.
Hoffman. Yes, hello, as my friend and colleague in Berlin. Thank you for joining me for this. I'm honored to have you and other of my doctor colleagues around the world. This is the very first of our multicast. I'm not sure if you're watching in YouTube or if you're watching in Facebook, if you're watching in Instagram in the Naked Beauty or the Dr. Rubenstein pages, but thank you for watching. We're going to be doing this now at least once a month, and we'll be publicizing it more. This has been our first kind of soft launch, working out the kinks. Didn't have too many kinks, so good job, Milena. We're going to be back with this again. We'll tell you when we're going to be doing it, but I want to do this on a regular basis. It's all for you. And we're going to have some guests. Today we didn't have anybody come on screen with me, but if you had questions like Dr. Hoffman, it would have been my pleasure and honor to have you join us on this broadcast and add your thoughts to everything I'm talking about. I hope you're not seeing this in Germany as much as we see it here in Miami, or in the United States in general. But thank you for joining us. We're going to let you know when the next one is. Look out for the Naked Beauty podcast. This is episode 1 of what I hope will be many, many to come. Thanks again. We'll see you next time on the Naked